of you have heard of John Nash? And what might this man be remembered for? Some people may know him as the famous mathematician who won the 1994 Nobel Prize at the age of 65, while others may only remember him or have any awareness of this man through when his name is paired with the term paranoid schizophrenic. So the point of this story is that John Nash was a paranoid schizophrenic, but he was able to get out of the schizophrenia and work his way into a more normal life, and he did win the 1994 Nobel Prize, and even though he was a paranoid schizophrenic. So I've discovered what it means to be a person suffering from schizophrenia and what can be done to rectify this issue, or at least improve the outcome for such patients. And as a nursing major, I'm interested in becoming a psychiatric mental health nurse and studying psychological problems and disorders such as schizophrenia, and working with schizophrenic patients because really I think it's a very interesting disorder. To become familiar with schizophrenia, we're going to discuss several main topics, including some background information, some of the causes and symptoms, the treatment for schizophrenia, as well as a prognosis or an outcome for the future. So to better understand schizophrenia, let's begin with the definition along with a brief history. So the background information provided about schizophrenia reveals an interesting insight into the disorder. And the definition of schizophrenia is that it's a brain disorder, and it involves difficulty depicting real and unreal events, difficulty thinking logically, and also difficulty interacting in social situations. And that was according to PubMed Health. So who it affects, according to schizophrenia as it appears in PubMed Health, is about 1% of Americans, and it usually occurs equally between men and women, although for women it will occur later in life, and it's also a more milder form then. It usually begins in the teens, like around age 16, and then it could go up to about 35. And then it could sometimes be found in children, although this is a very rare case. The term schizophrenia was adopted in 1911, and according to the National Institute of Mental Health, during medieval times, schizophrenia, like other illnesses, was often viewed as evidence of the sufferer being possessed by spirits or evil powers. So now that we have defined what schizophrenia is, we can move into the causes of the disorder. And some of our causes include hereditary, environmental, and marijuana. So for hereditary influences, we said that the family could be predisposed, and just basically a family history of schizophrenia. We have, according to the article, older age of father increases the risk of schizophrenia. I found that children born to older fathers are also more likely to get schizophrenia because of the sperm is getting older, and the more times it's been replicated, the more chances for a mutation exist, and that could lead to the schizophrenia. And some of our environmental influences include the mom having some kind of an infection during the pregnancy, and also life-changing events during childhood, according to the National Institute of Mental Health, would lead to some of these schizophrenia-like symptoms, which those could include the loss of a parent, emotional, sexual, or physical abuse, and physical or emotional neglect. And then I also found that marijuana, according to the article Marijuana, Cannabis, and Schizophrenia, could be a cause for schizophrenia, and it increases the risk for people under the age of 21 who are using the drug, and it increases dopamine levels in the brain, which do lead to this disorder. And then the younger you are when you start using the marijuana would lead to a higher risk, and the disease would be worse off once it developed. And then I also thought it was interesting that teens using marijuana even 5 times greatly increased their risk of the symptoms. And of course, the people with a genetic history of schizophrenia and using marijuana would be at the highest risk. And then, according to Marijuana, Cannabis, and Schizophrenia, the article, I found that about 8 to 13% of cases of schizophrenic patients, had they not used marijuana, then they wouldn't have even had the schizophrenia occur for them. So here was just this chart that showed that schizophrenia, the number of times you have used marijuana shows an increase in schizophrenia-like symptoms. So now that we are aware of the main causes of schizophrenia, we can continue with the symptoms of this disorder. And there's a wide range of symptoms, and they're subdivided into 3 groups, which would be positive symptoms, negative symptoms, and cognitive symptoms. The positive symptoms include the addition of behaviors that are not usually present, and we have hallucinations, which would be hearing, seeing, or feeling things that aren't really there. Delusions, which would be false beliefs, or believing you're being spied on, or even thinking you're someone else, and they usually would think that they're a famous person. We have thought disorders, which would include dysfunctional thoughts, word salads, which would be garbling your speech together and just putting words together that don't really go together so it doesn't make sense, and abrupt stops to speaking. We also have movement disorders, which would include restless movements, repetitive movements, and a catatonic state. Some of our negative symptoms include the loss of behaviors that are usually present, and we have the flat effect, which is basically when the patient sits there with no emotion on their face and they just sit like as still as a stone, basically. So we also have a lack of pleasure, the inability to care for oneself, and that usually would include the personal hygiene. They would kind of start to neglect that. And then we also have a little speech patterns, or little to no speech at all. And then our cognitive symptoms, we said, are rare to detect, but those include the inability to pay attention and the inability to use information that is just learned, and they sometimes can't even understand the information. So now that we have covered the basics of schizophrenia, we can continue into the treatment plans for the disorder. And although schizophrenia is not a curable disorder, there are ways in which we can make the symptoms more livable in the day-to-day life of patients. And we can do that through antipsychotic medications and psychosocial treatments. The antipsychotic medications change the balance of chemicals in the brain, and they also help to control symptoms. So we have typical kinds which were available in the mid-50s, and we also had an atypical kind of antipsychotic which became available in the 90s. And a common side effect of these two would be tardive dyskinesia, which would include muscle movements around the mouth and just facial movements that the patient can't control. And once you stop taking the drug, then you can cause partial or full recovery from tardive dyskinesia. And then our psychosocial treatments include support programs and family treatments, and both of these reduce the chances for symptoms recurring, and they help the patients to cope with these symptoms. So now that we have expanded upon the treatments for schizophrenia, we can continue into the prognosis and expectations for the future. And like I said, schizophrenia is not a curable disorder, but the outlook for the future shows promising results for those patients suffering from this mental illness. Patients that can improve with the medications include they could live in supported housing units, they could go to community support programs, and also work rehab. And these people can usually have relatively normal relationships still. And then we have patients with functional disabilities. These people are at risk for repeats and they're too severe to live alone, so they would live in group homes, or they could also live in long-term places to live. And then also we have research going on today, according to the National Institute of Mental Health. They're working to understand the causes of schizophrenia and also predict and prevent it, while they're still developing better treatments and more effective medications. So in conclusion, schizophrenia is a severe mental illness, yet it can be manageable through a variety of treatments and support, while continuing to be a subject of research in order for improvements to be made. And after listening to this presentation, I hope to have better informed you about schizophrenia, including the background information and the history, some of the causes and symptoms, and the treatments that are available, as well as a prognosis and an outlook for the future of the disorder. So after you hear about a patient with schizophrenia, and after hearing John Nash's story, don't assume that the person isn't going to be functional still, because based on John Nash's story, patients can work their way out of it and lead a relatively normal life, and he even had an exceptional life. Thank you.